In this procedure, we'll be placing a Ultra Plus neuticle with an epididymis into a scrotum next to a testicle. The dog had had a retained testicle that was previously removed, and the owners would like a second testicle in the dog. We are checking for position. We want to make sure we have the correct testicle size. The testicle has been sterilized preoperatively. The Ultra Plus with epididymis has an epididymis that will go down into the cranial tunics in a normal dog. If the testicle is removed, it would slide down in the tunic. But in this case, there is no vaginal tunic to put this in, so we are going to open the scrotum with a laser. And the laser helps us so we don't have any bleeding. But we'll open this with a laser, and then we'll place the neuticle next to the existing testicle. The epididymis, if we were just using a regular Ultra Plus neuticle without an epididymis, there probably would be risk of movement if it wasn't anchored properly. But because we have an epididymis on this, we will be able to anchor the neuticle in proper position. We do not have an area, pre-existing area for the testicle to go in, so we will blunt dissect the area. In a case like this, we figured for maybe several weeks, the existing scrotum will have to stretch to accommodate the two testicles. This dog had a little bit of edema postoperatively, but within 3 to 5 days postoperatively, all the edema was gone, and both testicles are in proper position within, I would say, 7 to 10 days postoperative. We tried to keep the dog fairly calm after surgery, but this is a very, very busy dog. They do a lot of physical activity with this dog. We're doing initial check just to see incision size. The testicles are pretty resilient and can take quite a lot of pressure on the testicle. So what we want to do is we want to make our opening small enough so that the testicle fit in, but not large enough that I have to worry about the testicle moving around after I close the procedure. And the testicle being just a little bit larger than the end of a finger, if I make an opening large enough for my finger in a blunt dissection, I shouldn't have any trouble fitting the testicle in at all. And it does appear to fit quite nicely. The epididymis that we had to dissect down cranially and dorsally in that position towards the inguinal canal so that the epididymis would go in. The opening had to be changed just a little bit to accommodate for the epididymis. And in a normal procedure where this is placed inside the vaginal tunic, it's a very quick procedure, and this just makes it a little more difficult because we just didn't have a place to put everything. We wanted to make sure that the epididymis was straight and that it was parallel with the left testicle epididymis also. And that way, palpation-wise, they'd be the same. Now, one thing that is interesting, if there was ever any question about this dog on an ultrasound, it would be immediately obvious that the testicles are not the same. But when you palpate this dog post-operatively, even though we didn't have a vaginal tunic to put this neuticle in, it's very, very difficult to tell which side the neuticle was and which side the original testicle was in. And what we're going to do in the bottom is we're going to put a stay suture through the epididymis and then into the vaginal tunic across the base of the penis. And this will make sure that we don't have any migration of the implant. We are using 2 monochrome for the procedure. No problem with reabsorption of this, less issues than using, I think gut sutures would be a mistake in something like this just because of the tissue reaction that you get from gut sutures. But monochrome PDS, one of the monofilament reabsorbable sutures would be just fine for this procedure. And you can see there's some edema in the existing testicle as we're working right now. And it wasn't expected at the start of this, and the edema was there before we were suturing, so we didn't hit a blood vessel in there. But the edema came shortly after we dissected the opening for the second test for the neuticle, and that was what took several days to retract. But it was about 2 days, and it was back to normal completely. At no time was the dog uncomfortable with the procedure. We did not have to use a cone. We usually have e-collars waiting just in case there's any issue with this. But in this case, the dog, he didn't care at all. And the difficulty with him over the next several days was to keep him quiet, because we did not want to get more edema in the area because he was active. But you can see we're trying to move the left testicle back down in the scrotum, and it just didn't want to go back in because of the edema that was going on. Closure of the surgery is a subcuticular closure. We do a continuous anchored into the fascia and then close it. This way we have no skin sutures at all. Most of the dogs we do this on do not lick, itch, chew, or get any kind of edema postoperatively from the sutures. We kept him quiet for about 5 or 6 days after surgery, but again, all the swelling was down by the second or third day. When we do our subcuticular suture, as we do our passes, we will then take a fascial plane bite also, so that the incision stays intact in the center, and then we're ablating the dead space underneath the incision. The whole procedure is very, very quick. The length of the procedure probably has a little bit to do with not much irritation postoperatively in the dog. The tissues have not been handled for a very long time. There's no drying of the tissue, and the dog's full anesthetic time in this case was probably only 15 minutes. We bury the knot, going back cranial in the incision, so that the knot is buried and attached to the fascia underneath the skin, and that way no existing knot, no irritation. And this is the point where we bury the knot in the fascial tissue. We go around the end of the incision, come back to anchor the material, and then it will allow us to pull the incision closed back around the knot, and then the skin will cover it over. Very normal looking scrotum postoperatively. And once the testicles are pushed down about where they belong, it looks like he should get some more stretching in the scrotum to accommodate the two testicles after a couple weeks.